Good morning. Talking about chapters 18, 19, 21, and 7 today. We're talking about postpartum changes. So, postpartum physiological changes is chapter 18. As we're going through the reading, I want you to pay attention to the blue words. The blue words are super important, of course, and they might be test questions and they could be on the NCLEX. So, just make sure you have those written down and that they are defined and you've got clear understanding of what those are. So, postpartum physiological changes, we're talking about the time from birth to the time that the uterus is shrunk all the way back down to its normal pre-pregnant state. And the process in which the uterus shrinks all the way down is called involution. It's your first blue word in chapter 18. While we're taking care of patients in the hospital for 24 to 72 hours after delivery, we would expect to find the uterus at the level of the umbilicus, a little bit above, a little bit below. That's pretty normal for our time frame that we're taking care of them. But in the course of after delivery all the way until 6 to 8 weeks later, the uterus shrinks all the way down into the pelvis to the little tiny thing it is, just teeny tiny inside the pelvis. We like to have the uterus firm while we're evaluating and while the patient is recovering for a very important reason. So the biggest complication after delivery is bleeding. And when the uterine muscles are relaxed and soft and not firm or atonic, we have a very high risk of bleeding because the blood vessels that supply the placenta inside the uterus are very large. They're large, almost to the diameter of a pin for some of them. And there's many of them, and they connect through the muscles of the muscle fibers of the uterus to the placenta. And when the placenta detaches away and goes away, those blood vessels are just left sticking out there into the muscle, into the opening of the uterus. And if the muscle fibers are relaxed and weak, like my fingers are, there's no pressure on those vessels. They're wide open. They can just bleed, and they can bleed a lot. When the muscle fibers are firm or tight, it puts pressure onto those blood vessels and it pinches them off and it keeps that bleeding under control. So we like to have the uteruses firm, and that's what we're assessing. So when we do a palpation for a fundal check, we're looking for what position the uterus is in the body and if it's firm or not firm. And those are clues to help us figure out how to take care of our patient and to give her the appropriate treatment. There's bleeding after delivery that is normal, so you're not going to prevent all bleeding from happening, and then the bleeding after delivery is called lochia. There's 3 types, rubra, serosa, and alba. Rubra is the initial bleeding that you're going to see, and it's bright red, which rubra means, if you know root words, rubra refers to red. So it's bright red, and it's fairly copious. It's a heavy period type amount, so enough to need to wear a pad and to change it frequently. The next discharge or lochia that we're going to have is serosa, and that's kind of a more serum-y, less red color, and then we go into the alba, which is a whitish discharge. In total, that whole period of change down to the alba takes about 6 weeks or so. Let's see, cervix is immediately soft after delivery. It can be bruised immediately after delivery, and then that'll get firm and go back to its normal size and shape. The biggest difference in the cervix is once a mom has had a baby, I'm looking for a piece of paper here, hold on one second. Once a mom has had a baby, the opening of the cervix changes shape. So a mom who has never had a baby before is going to have a cervix, and it's going to have a little opening that's going to look like a little circle or like a little dot. Okay. When a mom has had a baby before, we can often tell just by looking at her cervix on a cervical exam or on a pelvic exam, because her cervix is going to look like a little upside down smile, like a little frowny face, because that opening has been stretched and then it's come back together. So cervix will come back to this after a delivery, but a first-time mom who's never had a baby before, her cervix will look like this when you look at it. Nothing significantly, and you're not going to, as a bedside nurse, you're not going to look at cervixes, but if you are in OB clinic and that kind of thing, you would be able to see that. There's a lot of hormonal changes, of course. The placental hormones are gone all of a sudden. The mom's body shifts to her normal hormone procedures. The oxytocin that's there to help contract the uterus is also being let go for milk production. if she wants to do that. And then she'll return back to fertility, where the placenta, or not the placenta, but the ovarian and the pituitary hormones will take over with the fertility, with the cycle of that. Going through, let's see, there's a whole section on endocrine system hormonal changes. Read through that. Make sure you understand that. Breastfeeding, there's a lot of changes in the breasts. The hormones that control lactation, prolactin, and oxytocin. In the first 24 hours after birth, there's not very much change in the breast tissue. The first milk, called colostrum or early milk, is a clear, it's not really clear actually, it's pretty thick and yellow. And it can be expressed from the breast immediately. The breasts gradually become fuller and heavier, and the colostrum transitions to milk in about 72 to 96 hours, which is 3 to 5 days. And some women can take longer than that. And when we talked about bilirubin, I talked about how we need to feed the babies, because in that period of time when they don't have a lot of volume, that 72 to 96 hours, the babies need the volume of milk to get that bilirubin flushed out of their system. And this is why I see a lot of these kiddos need to be supplemented, or we need to pump and try and encourage that breast milk production. Non-breastfeeding moms are going to need to do things to prevent their milk from coming in. And the biggest advice that I always give my patients is to avoid any stimulation whatsoever to your breasts. So a firm fitting bra, sometimes they bind them, even turning your back away from the hot water in the shower so that you're not stimulating the nipples of the breast, because that stimulation will help bring milk in, and you're trying to prevent that from happening or decrease the time that it occurs. Engorgement is a word that we're going to run into. And engorgement is when the milk comes in and the breasts are suddenly very full and very firm. And sometimes it's painful, sometimes it causes a little bit of a fever, and it also makes latching on for the baby a little bit more difficult because the breast has suddenly changed shape and texture. And we have to support moms through that with lactation consulting and helping them and learning how to do good latch and that kind of thing. And that's not something that you're expected to know at this level, but if you were to get into postpartum nursing or labor and delivery nursing, it's something that you would learn how to use learn to do over the course of time. There's some big changes in blood volume. We add a whole bunch of blood volume to our body to support a pregnancy, and then all of a sudden we lose that. We lose that in the placenta, and we lose that in the baby. So that extra blood volume that we're circulating around with the baby and the placenta, that goes away. So there's a huge shift, but the cardiac output doesn't change initially. So they have good, strong cardiac output, but they're decreased a little bit. There's some vital sign changes. You can go over that in the book. Blood components, we're going to watch for hematocrit and hemoglobin on moms. They have had a blood loss, and naturally our bodies increase our hemoglobin and our hematocrit. We try to anyway. Some people suffer with anemia with their pregnancies, but we try really hard to increase the amount of hemoglobin and hematocrit our bodies make naturally. That's just a natural survival mechanism because we are going to have a blood loss, and we're built to survive those blood losses particularly. But we do often check H&Hs, hematocrits and hemoglobins 24 hours after delivery, and sometimes even further if we've had a large loss or if a patient's got a suspected issue. We don't routinely do white blood cell counts on postpartum moms unless there's an issue or we're following up on something with pregnancy or with labor. So if she started to develop a little bit of an infection in labor, we would follow up with a white blood cell count. Coags, we only need to do for patients who have risk factors for abnormal coags. So either they have a risk because of disease processes that they already have, or something that developed with labor and delivery. That's basically it. There's some physical changes in the immune system. The bottom line, or the overarching point for chapter 18 is that every system in the body is affected by pregnancy, and that means that every system in the body is going to have postpartum physiological changes. So read through those sections. Make sure you post any questions or forward any questions that you have about chapter 18, and we'll go on to chapter 19 here in a little bit. Okay, thanks.